My doctor dismissed my chest pain as anxiety. Then I had a heart attack in his waiting room. I came to on the floor of Dr. Graham Westbrook's waiting room with a nurse straddling my chest, doing compressions so hard I could feel my ribs flexing. The receptionist was screaming into the phone with 911. The elderly woman who'd been sitting across from me was pressed against the wall, her magazine forgotten on the floor. I couldn't breathe. My chest felt like it was being crushed in a vice, radiating pain down my left arm and up into my jaw. I tried to speak, but nothing came out except a wet, gurgling sound. The nurse, whose name tag read Kelly, kept pumping my chest rhythmically, her face pale and focused. "Stay with me," she kept saying. "Ambulance is coming. Stay with me." The last thing I remember before losing consciousness again was the waiting room door opening and Dr. Westbrook standing there in his white coat, his face drained of color, staring at my body on his floor like he was seeing a ghost. I'd been Dr. Westbrook's patient for almost 2 years, ever since I moved to Portland for work and needed a new primary care physician. He came highly recommended from my company's HR department, had stellar online reviews, ran a clean, modern practice in the Pearl District with efficient staff and minimal wait times. He was in his early 50s, fit and professional, with the kind of confident bedside manner that made you feel like you were in capable hands. His office walls displayed an impressive collection of credentials: medical degree from Stanford, residency at Johns Hopkins, board certification in internal medicine, membership in multiple professional societies. He'd treated me for a sinus infection, a sprained ankle, my annual physical, normal stuff. I trusted him completely, which is why when the chest pain started and he told me it was anxiety, I believed him. I ignored every screaming signal my body was sending because the expert said I was fine. The first episode happened on a Monday morning in September while I was getting ready for work. I was 36 years old, a project manager at a tech company, generally healthy aside from being maybe 15 pounds overweight and drinking too much coffee. I was in the shower when I felt a sudden tightness in my chest, like someone had wrapped a steel band around my ribcage and was slowly cranking it tighter. The sensation spread across my chest and down my left arm. I felt lightheaded and nauseous. I had to sit down on the shower floor until it passed, water streaming over me, my heart racing. The episode lasted maybe 10 minutes before gradually fading. When I got out of the shower, I was shaky and exhausted. I convinced myself it was nothing. Maybe pulled a muscle at the gym the day before, maybe drank too much coffee on an empty stomach. I went to work and tried not to think about it. The episodes kept happening, 3 times that first week, always in the morning, always triggered by mild exertion like climbing stairs or rushing to catch the train. Each time, the same crushing chest pressure, the same arm pain, the same nausea and dizziness. By Friday, I was scared enough to call Dr. Westbrook's office. His scheduler, a friendly woman named Patricia, got me in that afternoon. I left work early and drove to his office, my hands gripping the steering wheel tighter than necessary, hyper-aware of every sensation in my chest. The waiting room was its usual calm, professional space with neutral colors and soft music. I filled out the intake form describing my symptoms: chest tightness, left arm pain, shortness of breath, episodes triggered by exertion. I checked the box indicating this was urgent. Dr. Westbrook saw me 20 minutes later. I described the episodes in detail, trying to be clear and specific about the location of the pain, the quality of it, what triggered it, how long it lasted. I told him I was worried about my heart. He listened while typing notes into his computer, his expression neutral and professional. When I finished, he turned to face me and smiled reassuringly. "Michael, what you're describing sounds like classic anxiety attacks. The chest tightness, the arm pain, the shortness of breath, these are all textbook symptoms of panic disorder. You mentioned you recently started a new position at work, correct?" I nodded. He continued, "Career stress is one of the most common triggers for anxiety symptoms in men your age. Your body is manifesting psychological stress as physical sensations. It's extremely common and nothing to worry about. If you are enjoying this story already, please subscribe to see more stories like this." I tried to push back, but it only happens when I exert myself, when I climb stairs or rush around. That seems different from anxiety. Dr. Westbrook's smile remained patient. "Anxiety doesn't always make logical sense, Michael. Physical exertion can trigger the stress response in people with anxiety disorders because your body associates elevated heart rate with danger. It's a feedback loop. Your heart rate goes up from climbing stairs, your anxious brain interprets that as a threat, and you experience panic symptoms." He checked my blood pressure, which was slightly elevated at 138/86, and listened to my heart for maybe 20 seconds with his stethoscope. "Your vitals are normal. Heart sounds are good. You had a completely normal EKG at your physical last year. You're 36 years old. You exercise regularly. You don't smoke. The statistical likelihood of cardiac disease in your demographic is very low. What you need is stress management techniques and possibly a short course of anti-anxiety medication to break the panic cycle. But what if it's not anxiety? What if there's actually something wrong with my heart?" Dr. Westbrook's patience was starting to wear thin. I could see it in the slight tightening around his eyes. "Michael, I've been practicing medicine for 23 years. I can assure you these symptoms are anxiety-related. Running unnecessary cardiac tests on a low-risk patient is not good medicine. It's wasteful, and it feeds into your health anxiety, which will make your symptoms worse. I'm going to prescribe you a low dose of Ativan to take when you feel the panic coming on, and I want you to start doing breathing exercises and meditation. You'll see improvement within a few weeks. He printed a prescription and handed it to me. Trust me on this. You're going to be fine. I wanted to believe him. He was the expert with decades of experience and impressive credentials. I was just a guy who managed software projects and had no medical training. I took the prescription and left, feeling both relieved and vaguely uneasy. The Ativan helped a little with the anxiety about the chest pain, but it didn't stop the episodes. They continued happening, 3 or 4 times a week, always with exertion, always the same crushing pressure and arm pain. I started modifying my behavior to avoid triggers. I took the elevator instead of stairs. I left earlier for work so I didn't have to rush. I stopped going to the gym. The episodes still happened, just less frequently. By mid-October, new symptoms appeared. I was exhausted all the time, bone-deep fatigue that sleep didn't fix. My appetite disappeared, and I lost weight without trying. I started getting short of breath doing simple things like carrying groceries or playing with my nephew. I felt like my body was slowly failing, and I couldn't figure out why. I called Dr. Westbrook's office again and got another appointment. This time I brought documentation, a detailed log of every episode for the past 6 weeks, including date, time, duration, severity, and what triggered it. I'd tracked my heart rate during episodes using my fitness watch. I'd documented the pattern clearly showing symptoms only occurred with physical exertion. Dr. Westbrook barely glanced at my log. Michael, this kind of obsessive symptom tracking is actually counterproductive. You're hyper-focusing on normal bodily sensations and interpreting them as dangerous, which creates more anxiety. He checked my weight and noted I'd lost 12 pounds. That's concerning, but it's consistent with anxiety-related appetite loss. Have you been under additional stress? I told him about the fatigue and shortness of breath. He made notes. These are also classic anxiety symptoms. Chronic stress causes fatigue and can make you feel short of breath even when your oxygen levels are fine. The solution isn't more medical tests, Michael. The solution is addressing the underlying anxiety. I'm going to increase your Ativan dosage and refer you to a therapist who specializes in health anxiety. Cognitive behavioral therapy is very effective for patients who fixate on physical symptoms. I left that appointment feeling dismissed and frustrated. My body was telling me something was seriously wrong, and the person I'd trusted to help was telling me it was all in my head. But he was the doctor, so I tried to believe him. I made an appointment with the therapist, a woman named Dr. Lisa Kovacs who specialized in anxiety disorders. She was kind and professional, listened to my concerns, and walked me through CBT techniques for managing health anxiety. The therapy helped with my worry about the symptoms, but it didn't stop the symptoms themselves. The chest pain continued. The fatigue worsened. I kept losing weight. By early November, I was having episodes almost daily. The chest pressure was getting more intense and lasting longer, sometimes 20 or 30 minutes before subsiding. I started having episodes at work, having to excuse myself from meetings to sit in the bathroom until the pain passed. My boss noticed my performance declining and pulled me aside to ask if everything was okay. I told him I was dealing with some health issues but was working on getting them resolved. My ex-girlfriend Jenna, who I still talk to occasionally, called me one evening and said, I sounded terrible. Michael, you need to get a second opinion. If your doctor isn't listening, find one who will. I told her Dr. Westbrook was a highly respected physician, that he'd assured me this was anxiety, that I was probably just catastrophizing like he said. The Saturday before Thanksgiving, I had the worst episode yet. I was at my parents' house in Seattle for the weekend, helping my dad rake leaves in the backyard. We'd been working for maybe 20 minutes when the chest pain hit like a sledgehammer, crushing, radiating pain that dropped me to my knees. My dad rushed over, his face alarmed. Michael, what's wrong? I couldn't speak, couldn't breathe properly. He helped me into the house, and my mom called 911. The paramedics arrived within 8 minutes. They ran an EKG right there in my parents' living room while I sat on the couch clutching my chest. One of the paramedics frowned at the EKG printout and showed it to his partner. They had a quick, quiet conversation I couldn't quite hear. Then they turned to me. Sir, your EKG is showing some abnormalities. We'd like to transport you to the hospital for evaluation. At Swedish Medical Center's emergency department, I was seen by Dr. Raymond Okoye, an ER physician with 20 years of experience. He reviewed the paramedic's EKG and immediately ordered additional tests. Blood work, another EKG, a chest X-ray. The blood work showed elevated troponin levels, which Dr. Okoye explained indicated my heart muscle was under stress or being damaged. He admitted me for observation and scheduled a stress test for Monday morning. I spent the weekend in a hospital bed, hooked up to monitors, watching my heart rhythm on the screen while nurses checked on me every few hours. The chest pain had subsided, but I felt weak and scared. Dr. Okoye came by Sunday evening to check on me. Your troponin levels have come down, which is good, but I'm concerned about the pattern of symptoms you've described. Monday's stress test will help us determine if there's an underlying cardiac issue. The stress test on Monday morning lasted 6 minutes before they stopped it. I was on the treadmill, hooked up to EKG leads and a blood pressure cuff, when the chest pain started again. The cardiologist supervising the test, Dr. Neil Jacobson, watched the monitors and immediately called a halt. That's enough. We've got what we need. The EKG changes during exertion, combined with your chest pain, strongly suggest cardiac ischemia, meaning your heart isn't getting adequate blood flow during stress. I'm ordering a cardiac catheterization to visualize your coronary arteries. We need to find out what's causing this. The catheterization showed the truth that had been there all along. I had significant blockages in 2 coronary arteries, 75% occlusion in my left anterior descending artery and 60% occlusion in my right coronary artery. Dr. Jacobson showed me the imaging afterward, pointing to the narrowed sections of artery where blood flow was restricted. This is why you've been having chest pain with exertion, Michael. Your heart muscle isn't getting enough oxygen when it's working harder. These blockages have been developing for a while, probably years. The good news is, we caught them before you had a major cardiac event. I'm going to place stents in both arteries to open them up and restore proper blood flow. We'll do that this afternoon. I laid in the pre-op area staring at the ceiling, trying to process what I'd just learned. I'd spent 2 months telling Dr. Westbrook I had chest pain with exertion. I'd described the exact symptoms of angina. I'd documented everything carefully, and he'd dismissed it all as anxiety without ordering a single cardiac test. If I hadn't collapsed at my parents' house, if they hadn't called 911, if the paramedics hadn't recognized the abnormal EKG, I would still be taking Ativan and seeing a therapist while my coronary arteries slowly closed off completely. Dr. Jacobson had told me bluntly that with blockages this significant, I was at extremely high risk for a major heart attack. It wasn't a matter of if, but when. The stent placement went smoothly. Dr. Jacobson successfully opened both blocked arteries, and the relief was immediate. For the first time in months, I could breathe normally. The constant low-level chest discomfort I'd gotten so used to was gone. I felt like I'd been living in a fog, and someone had finally cleared the air. I spent 2 days recovering in the hospital before being discharged with a stack of prescriptions: blood thinners, beta blockers, statins, aspirin. Dr. Jacobson's discharge instructions were clear: cardiac rehabilitation, lifestyle modifications, close follow-up with a cardiologist, and I strongly recommend you file a complaint against the physician who dismissed your symptoms. What happened to you represents a serious failure of care. I contacted a medical malpractice attorney named Jonathan Rourke the week after being discharged. His office was downtown, professional and well-appointed, with framed case results covering one wall. Rourke was in his late 40s, sharp-eyed and focused, with the intensity of someone who'd spent decades fighting for clients against institutions. He listened to my entire story, taking detailed notes, asking specific questions about my appointments with Dr. Westbrook, about what I'd reported and how he'd responded. When I finished, he leaned back in his chair and shook his head. "This is egregious, Michael. You presented with textbook angina symptoms, exertional chest pain radiating to your arm. Any competent physician should have immediately ordered cardiac workup, at minimum a stress test. Dr. Westbrook's failure to do so, and his dismissal of your repeated concerns, represents clear medical negligence. You could have died." Rourke requested my complete medical records from Dr. Westbrook's office and from Swedish Medical Center. When the records arrived, we reviewed them together. Dr. Westbrook's notes from my appointments were revealing in their inadequacy. He documented my symptoms, but consistently framed them as anxiety-related, without providing clinical reasoning for excluding cardiac causes. He'd noted my age and general health as reasons not to pursue cardiac testing, but he'd never documented a risk assessment or explained why my specific symptom pattern didn't warrant investigation. His notes repeatedly described me as anxious and health-focused, in ways that undermined my credibility as a historian of my own symptoms. He'd increased my Ativan dosage instead of reconsidering his diagnosis when symptoms worsened. Most damning, he'd never ordered any cardiac testing despite 2 months of escalating symptoms. The records from Swedish told a different story. Dr. Okoye's ER notes documented abnormal EKG findings, elevated troponin, and clinical presentation consistent with acute coronary syndrome. Dr. Jacobson's catheterization report described significant coronary disease that had clearly been developing over an extended period. His notes stated explicitly that my symptoms were classic for angina, and that the delayed diagnosis represents a serious failure of outpatient care that placed patient at imminent risk of myocardial infarction. Both physicians independently documented their concern about the delay in diagnosis. Rourke hired a medical expert to review the case, Dr. Philip Dorsey, a cardiologist with 35 years of experience who now worked as an expert witness. His written opinion was unequivocal. Dr. Westbrook's care had fallen far below the standard of practice. Any physician presented with a patient reporting exertional chest pain and arm pain should immediately consider cardiac ischemia as a possible cause, Dr. Dorsey wrote. The failure to order even basic cardiac testing, such as a stress test, represents a gross deviation from accepted medical practice. The patient's age and general health do not exclude cardiac disease, especially given the symptom pattern described. Dr. Westbrook's attribution of these symptoms to anxiety without adequate investigation endangered the patient's life. His conclusion: clear and indefensible negligence. While Rourke prepared the malpractice case, I filed a complaint with the Oregon Medical Board. The investigator assigned to my case was named Douglas Finch, who'd worked for the board for 18 years reviewing complaints against physicians. He called me 3 weeks after I filed to discuss the case. "Mr. Lawson, I want you to know that your complaint has triggered some concerns on our end. This isn't the first time Dr. Westbrook's diagnostic practices have been questioned. We have 2 other open complaints from patients who reported similar issues, symptoms dismissed as anxiety or stress without adequate workup, leading to delayed diagnoses. One involved a delayed cancer diagnosis, the other, a missed pulmonary embolism. Both patients suffered significant harm. If this story keeps your interest, please subscribe to get more stories like this." The medical board opened a formal investigation into Dr. Westbrook's practice patterns. As part of that investigation, they reviewed hundreds of his patient charts looking for evidence of systematic problems. What they found was troubling. Dr. Westbrook had a pattern of making quick diagnoses based on patient demographics rather than thorough evaluation. Younger patients with concerning symptoms were routinely told their problems were stress or anxiety. Women with chest pain were particularly likely to be dismissed without cardiac testing. Patients who expressed worry about their symptoms were documented in ways that suggested hypochondria rather than appropriate health concern. The board identified at least 9 cases over the past 3 years where Dr. Westbrook had missed or delayed serious diagnoses by attributing symptoms to benign causes without adequate investigation. The board scheduled a formal hearing to determine whether Dr. Westbrook's license should be suspended or revoked. I was called to testify, along with the other patients who'd filed complaints. The hearing room was formal and intimidating, with board members sitting at a long table, Dr. Westbrook and his attorney on one side, the complainants on the other. I testified for over an hour, describing my symptoms, my appointments with Dr. Westbrook, his repeated dismissals, his refusal to order cardiac testing despite my documented and worsening symptoms. I presented my symptom logs, my medical records from Swedish, Dr. Jacobson's catheterization findings, Dr. Dorsey's expert opinion. The board members asked detailed questions about what specifically Dr. Westbrook had said, how he'd explained his clinical reasoning, whether he'd ever discussed the possibility of cardiac causes. The other complainants told similarly disturbing stories. A woman named Rachel Dunlap described how Dr. Westbrook had dismissed her persistent abdominal pain and bloating as stress-related IBS without ordering imaging. 6 months later, another physician ordered a CT scan that revealed stage 3 ovarian cancer. She'd undergone extensive surgery and chemotherapy and was now in remission, but the delay in diagnosis had allowed the cancer to spread and worsened her prognosis. A man named Christopher Vega described how Dr. Westbrook had attributed his chest pain and shortness of breath to anxiety, similar to my case. Christopher had eventually gone to the ER, where they discovered a massive pulmonary embolism, a blood clot in his lung that could have killed him at any moment. He'd spent a week in intensive care and would be on blood thinners for the rest of his life. Dr. Westbrook's attorney tried to argue that each case represented reasonable clinical judgment, that physicians cannot order every test for every symptom, that retrospective review always makes missed diagnoses appear negligent when they might have been reasonable at the time. But the pattern was undeniable. 3 serious conditions missed in 3 patients, all dismissed as anxiety or stress without adequate evaluation, all resulting in significant patient harm. The board deliberated for 4 hours before announcing their decision. Dr. Graham Westbrook's medical license was suspended for 2 years. The board's written decision outlined multiple violations of medical practice standards: failure to conduct adequate diagnostic workup when presented with concerning symptoms, pattern of dismissing patient concerns without clinical justification, inadequate documentation of clinical reasoning, and failure to reconsider initial diagnoses when symptoms progressed or failed to respond to treatment. The suspension was conditional, requiring Dr. Westbrook to complete additional training in diagnostic reasoning and patient communication before being eligible to practice again. The board's decision made clear that Dr. Westbrook's shortcomings weren't isolated mistakes, but systemic failures that had endangered multiple patients. My malpractice case settled for $950,000, 8 months after I filed. Dr. Westbrook's insurance company agreed to the settlement after reviewing the evidence, which they knew would be devastating if presented to a jury. The settlement covered my medical expenses, lost wages from time off work, pain and suffering, and future medical monitoring. More importantly to me, the settlement was not subject to a confidentiality agreement. I was free to discuss what had happened, to warn others, to ensure Dr. Westbrook's failures were part of the public record. But the money didn't undo the damage. I had 2 stents in my heart. I took multiple medications daily and would for the rest of my life. I couldn't exercise the way I used to, couldn't push myself without worrying about triggering chest pain. I had actual anxiety now, not the kind Dr. Westbrook had incorrectly diagnosed, but real trauma-based anxiety about being dismissed by medical professionals. I recorded every doctor appointment on my phone because I didn't trust that physicians would listen or document accurately. I brought written symptom logs and medical records to appointments because I'd learned that patient testimony alone wasn't enough. I started seeing a therapist, Dr. Simon Rashid, who specialized in medical trauma. He helped me understand that what I'd experienced was a form of iatrogenic harm, damage caused by medical treatment, or in this case, by the lack of appropriate treatment. Dr. Westbrook's dismissal of my symptoms had made me question my own perception of reality, had taught me that my experience of my body couldn't be trusted, that authority figures knew better than I did what was happening inside me. Undoing that damage took time and conscious effort. Dr. Rashid helped me rebuild trust in my ability to advocate for myself, helped me understand that being a persistent patient wasn't being difficult, it was survival. I reached out to Rachel Dunlap and Christopher Vega after the medical board hearing. We'd bonded over our shared experience of being dismissed and harmed by the same physician. Together, we started attending meetings of a patient advocacy organization focused on medical errors and diagnostic failures. We learned that our experiences weren't unique. Diagnostic errors occur in an estimated 5% of outpatient encounters, affecting approximately 12 million Americans annually. Many of those errors result from cognitive biases, shortcuts in thinking that lead physicians to make incorrect diagnoses. Dr. Westbrook had fallen prey to multiple biases. Anchoring bias, where he locked onto anxiety as the diagnosis and filtered all subsequent information through that lens. Availability bias, where he assumed common things are most likely and didn't adequately consider less common but serious conditions. And affective bias, where his perception of patients as anxious or overly concerned influenced his clinical judgment. Rachel, Christopher, and I decided to turn our experience into advocacy. We started a support group for patients who'd experienced diagnostic errors or medical dismissal. We met monthly, sharing stories, providing emotional support, helping each other navigate the medical system with greater confidence and assertiveness. The group grew quickly. People were desperate to talk about their experiences of being dismissed, of having symptoms attributed to anxiety or stress when something serious was wrong, of being made to feel like they were overreacting or imagining things. The medical system's failure to take patient concerns seriously was widespread, and victims needed space to process that trauma. We also began advocating for policy changes. We testified before the state legislature in support of legislation requiring physicians to document clinical reasoning when declining to order diagnostic tests for potentially serious symptoms. We pushed for better training in medical schools about cognitive biases and their impact on diagnostic accuracy. We advocated for patient rights to second opinions and for insurance companies to cover those opinions when patients disagreed with initial diagnoses. Some of our efforts succeeded. Oregon passed legislation requiring more robust continuing medical education on diagnostic reasoning for licensed physicians. I went back to Dr. Westbrook's office building once, about a year after the medical board hearing. His practice was still there, though I noticed the waiting room was noticeably emptier than it had been when I was his patient. The receptionist was the same woman, Patricia, who'd scheduled my appointments. She didn't recognize me. I stood in that waiting room for a few minutes, remembering how I'd sat there filling out intake forms, trusting that I was about to receive competent care, not knowing that my symptoms would be dismissed and my life endangered. The memory made my chest tighten, though this time it was emotional pain, not cardiac. I filed one more piece of documentation regarding my case. I wrote a detailed review on multiple physician rating websites, describing what had happened, how Dr. Westbrook had dismissed my cardiac symptoms as anxiety, how I'd been diagnosed with significant coronary disease only after collapsing at my parents' house and being taken to a different hospital. I kept the review factual and unemotional, just the timeline and the outcome. Dr. Westbrook's attorney sent me a cease and desist letter claiming the review was defamatory. My attorney, Jonathan Rourke, responded that truth is an absolute defense to defamation and that everything in my review was supported by medical records and the medical board's findings. The review stayed up. 2 years later, Dr. Westbrook applied for reinstatement of his medical license. The medical board held another hearing to determine whether he should be allowed to practice again. I submitted written testimony describing the ongoing impact of his negligence on my life, my continued cardiac issues, my medical anxiety, my need for lifetime monitoring and medication. Rachel and Christopher submitted similar statements. The board granted conditional reinstatement, requiring Dr. Westbrook to practice under supervision for 2 years and to undergo quarterly audits of his diagnostic patterns. He would be watched closely, his patients would hopefully be safer, but he would practice medicine again. 3 years after my stents were placed, I'm alive. My cardiologist, Dr. Amanda Tomlinson, monitors me every 6 months with stress tests and imaging. My cardiac function is good, the stents are working properly, my medication regimen keeps my blood pressure and cholesterol controlled. I'm at higher lifetime risk for cardiac events, but I'm stable. I've learned to live within my new physical limitations, to recognize the difference between anxiety and actual cardiac symptoms, to advocate fiercely for myself in medical settings. I'm one of the fortunate ones. I survived Dr. Westbrook's negligence, but survival comes with scars. Every time I feel chest discomfort, even when I know it's probably indigestion or muscle strain, I have a moment of panic remembering how my legitimate symptoms were dismissed. Every time I see a new doctor, I have to battle the urge to record the conversation or bring a witness because I don't trust that I'll be believed. Every time I hear someone say their doctor told them their symptoms were just anxiety, I feel my stomach drop, wondering if they're being appropriately evaluated, or if they're heading toward the same outcome I barely escaped. I think often about the moment I came to on Dr. Westbrook's waiting room floor, my ribs aching from CPR compressions, unable to breathe, seeing his pale face staring down at me. That moment crystallized everything. I'd been right all along. My body had been screaming warnings, and the person I'd trusted to hear those warnings had silenced them. The heart attack in his waiting room was the universe's brutal way of proving what I'd known for months. I just wished the proof hadn't nearly killed me. I survived to tell this story, to warn others, to push for changes that might prevent the next patient from being dismissed. That has to count for something. It has to mean something that Dr. Westbrook's failures are now part of the public record, that his license was suspended, that other patients can see the warnings and choose different doctors. It's not enough. It will never be enough. But it's something. Every day I wake up and take my medications, I think about the waiting room floor, about Kelly doing chest compressions, about Dr. Westbrook's shocked face. I think about how close I came to dying in the office of the man who'd spent months telling me nothing was wrong. And I stay angry, because anger keeps me vigilant. Anger reminds me to trust my body. Anger drives me to help others advocate for themselves. Anger prevents me from accepting that this is just how the medical system works. I had a heart attack in Dr. Westbrook's waiting room, and I live to make sure everyone knows why. If you enjoyed this, you'll definitely want to see the next ones too. So subscribe now and let me know your take in the comments.